There's a cholera outbreak in the country. The Ministry of Health and the counties have basically been issuing alerts all the way into April. By April, we had cholera cases reported in Nairobi, Migori, Kisumu, among the counties, many counties that had cholera cases. Deaths have been reported. What's cholera? How is it spreading? What's causing it? How do we deal with it? I mean, why should you care? Well, just listen to the next conversation with Dr. Barabara Amonde, who is an expert on emergency matters and public health response. Dr. Good morning.
Good morning. How are you?
Very well, thank you.
Pleasure to be here.
Karibu sana. We fix the nation one conversation at a time, including this one, and we're joined by many fixers from the health space like you, and from the legal space like the guest before you. But before we get into this conversation, where you'll teach us about cholera. Basically here, just educate us, okay?
All right.
And treat us like we are children. We don't know.
Okay.
Please, Janet has the day's quote.
I do. Today's quote is by Oprah Winfrey. One of the many, many, many quotable quotes she's had. This one for today is, turn your wounds into wisdom.
Turn your wounds into wisdom.
Yeah.
Okay.
How does that sit with you? Can you relate to it?
Definitely.
Yeah.
As a human being, as a woman, as a mom, my take on that is we take the pain and the hurt and the painful lessons, mistakes that we have made in the past, and we use them to better our future, to act better, to respond better, and be better people. And if we were all to do that, I think we would be so much better as a society.
Yeah, that's powerfully said. Hapo kwa my mom, I was like, yep. And there's a whole pull-out. We didn't get to it. And it shows all these different moms saying, the best thing you can do is ask me, how can I help?
Right.
And then they kind of all break down, what does help look like for me? So thank you for speaking to that.
Oh, beautiful.
Yeah.
Beautiful.
It's a perfect segue.
There's a cholera outbreak.
Yes, there is.
Or so we are told. Explain.
There is an outbreak.
Really?
Yes.
Okay.
You seem surprised.
No, we hear it all the time, but people just seem to be moving on with life like, well, yeah, there's a cholera outbreak. Yeah, there's a flu outbreak. Yeah. I mean, it's like the so what.
Yeah.
So I'm asking you the so what.
Okay. True, and thank you for providing this platform to share information and provide awareness to the public on the fact that there is a cholera outbreak and what people can do to protect themselves. Yeah, so the first case was declared, I think, around February, so we've been battling it for 2 months. It's currently active in 3 counties. Started in Migori, where so far I think there are 53 cases. They seem to have the situation under control now. But we're still reporting new cases in Nairobi, in Kisumu, and now in Kwale County. Yeah, so far there have been 239 cases. That was the count as at the end of last week, and 11 deaths, unfortunately.
When you say 239 cases,
yes.
What do we mean? The people who've gone to hospital and they've been diagnosed with cholera?
Yes, that's right.
Okay. Is it likely that the number could be higher?
There is a possibility, yes. As well know, cholera it's kind of an indignifying disease. I can imagine. I'll explain what the symptoms are. So it's stigmatized, and there are people who may not be so ready to come forward and say, oh, I've suffered from cholera, especially if it's a mild case that can be managed at home. But also there's the fact that there are smaller health facilities that may be, in the community, especially in the informal settlements, that may not be registered and not reporting cases to the county. And cholera is a notifiable disease, so any case that is detected has to be reported to the public health for the purposes of surveillance. But that may or may not happen.
Right.
Yeah.
I think about a month ago, Mariam and I hosted somebody to talk about cholera. And then you're back here. I'm just wondering, how concerned are you about what's happened over the last month or so? Because we did have was she a healthcare worker?
Yes.
Trying to remember. And she came and talked about, what cholera is and how it's affecting. She did mention some of the counties that you've just listed. How concerned are you about what's happened over the last month or so?
With cholera, any outbreak is a concern. You need to be worried because while it is a very simple disease to treat, it's highly fatal, especially if interventions are not made very quickly. Within a few hours, a patient could die from cholera, especially if it's a child under the age of 5. They are more vulnerable to the adverse effects of the disease. So there is cause for concern because there are two things that will drive death in cholera. One is access to care, the time taken between a patient recognizing that they have symptoms and then presenting to the facility for treatment. And the other is the quality of care. So if we are not having all cases managed in facilities that are well equipped, that have HR who are well trained to treat cholera, then there is a chance that we will experience more mortalities, more deaths from cholera, which is very preventable.
That I wanted to get into that, the preventability of it, before we get into how to respond to it and how to treat it. Yeah, it's a preventable disease. People know that it's like, oh, wash your hands and this and that, but really, how does cholera spread and how do we prevent it, especially in areas where access to water sanitation may be a challenge?
Yeah, I think you're spot on. Water and sanitation is the driver of cholera outbreaks. If you don't have a robust and intact wash system in place, then the risk is there that cholera outbreaks will occur. As far as how cholera is spread, it's a fecal-orally transmitted disease. So literally feces to mouth. This will happen if you have poor hygiene practices, if you're not washing your hands with soap and water regularly, especially at the specific moments like after using the toilet, after cleaning a baby, maybe when you're changing a diaper, etc. But also the quality and the quantity of water that's available is a challenge. So how we prevent it? We talk about the 5 Fs. Make it easier to remember. So the first F is feces. We said it's fecal-oral transmitted. The transmission cycle is that somebody who is infected with cholera, of course they do their thing and the feces are now in the environment. Flies land on this fecal matter and can spread the bacterium to food, to water, which is then consumed and causes infection in others. That's really how the most common route of spread.
Flies. Should I blame this on the feces or the flies?
On all of them. It's a whole system working together. So we have feces, and that means that for prevention, we need to ensure that we have adequate sanitation facilities. We don't practice open defecation, which unfortunately is a reality for much of the country. The latrine coverage is low in many counties, especially in some of the arid and semi-arid areas. Proper disposal of human waste. The sewer system in the cities also is quite old and is prone to flooding and therefore contamination of water systems with the bacterium. So feces is number one. The second you've already mentioned is flies. Flies will land on the fecal matter, carry the bacteria to the food, to the water, and spread the disease. So you need to keep your environment free of flies. The first thing is ensuring there's good sanitation, so there are no flies hanging around in the community, but also hygiene at home. Yeah, just dispose your garbage well, make sure your kitchen is clean, the surfaces you're using to prepare your food should also be clean. The other F is food. The flies land on food, you eat the food, you get sick. So for food, good hygienic methods when you're preparing the food, and make sure you wash your hands before you begin, while you're cooking it, while you're eating or feeding somebody, especially a child. But also keep food covered. If you've cooked some food and there's some leftovers, make sure it's covered so the flies don't have an opportunity to land on it and spread the disease. Make sure you reheat your food well. If you eat cold food, the bacteria has thrived, and there's plenty of bacteria in there that can cause an infection, not just of cholera, but actually of any kind of diarrheal disease. In line with food is also fluids, usually water. So contaminated water will spread cholera. It's important to ensure that people have access to clean drinking water, whether it is from the source or by providing aquatabs, water purification tablets to ensure that the water is safe for drinking. And of course, it should also be stored in a hygienic way. The fifth F is fingers. Okay, so of course it's the fingers that will transfer the feces from wherever the feces come from to the plate or to the cup of water. It's the fingers that will, transfer them into your mouth. We had a lot of lessons from COVID-19. We didn't just see a reduction, like the hand hygiene did not just prevent COVID, but also respiratory infections. And in fact, there are real diseases as well, because everyone was practicing, very keen to wash their hands frequently with soap and water, the ideal way. Unfortunately, that pandemic ended and we kind of forgot about all that.
Right back to factory settings.
Exactly. And that contributes to cholera and other infectious diseases. So for prevention, in a nutshell, that is what you think of the 5 Fs.
Is prevention... go ahead.
As we go to looking at the 5 Fs, how does... So cholera is what? It's a bacteria?
Cholera is a bacteria.
It's a bacteria.
Yes.
How does the cholera bacteria get into my poop?
That's actually such a great question. Right. Let's go to the source.
Yeah. So cholera is in the environment. It's actually, at some point, was endemic. However, if you have good water sanitation systems, you should be able to keep outbreaks at bay. It was actually discovered in I think it was the 19th century, where there was a cholera outbreak somewhere, I think in the UK, and they were able to link it to a hand pump. So people who were coming to fetch water from there, drinking the water, using it for cooking, were getting sick. And when that hand pump was decommissioned, the outbreak subsided. So it's a bacterial infection. It usually survives in aquatic settings. Thrives in warm temperatures, so it's more common to be found towards the end of the dry season, at the beginning of the rainy season. But again, if you have good quality water to drink, if you have access to latrines, you shouldn't be having outbreaks occurring.
So the most likely route to the poop is water?
Water, yes. Water-contaminated food. So what happens at the end of the dry season? There's less water accessible. Not every Kenyan, not everyone in the world is as privileged as you and I to just go to your kitchen, open up the faucet and have water flowing. They have to fetch water from rivers or ponds or dams, which of course is not of the highest quality. We have people buying in the informal settlements, even in Nairobi, have to buy 20-litre mtungis of water from vendors within the community. So if you're not sure of the quality of the water, then that already poses a risk. And when it's the dry season, you have less water, so the quantity is not enough, but also you have poorer quality water in conditions that are more beneficial, more conducive for the cholera bacterium to thrive. Then the rains come. When the rain comes, there's water coming to the surface. You can get filling up of latrines and spillover of that waste into the water system, and that then contaminates and potentially can cause an outbreak of cholera.
There's strategic things that we can do, perhaps, to make sure that our water and sanitation systems are, not cholera-proof, but at least, we do have safe. Yes, I think that's the word. What are some of those things that could be done? I want to look at it from a national government perspective and then from individual perspective. I know we can wash our hands, and you said, to make sure our surfaces are clean, but let's start maybe from above and then come down.
Okay. Well, cholera being a problem of water and sanitation, ultimately the solution to it, and this has already been achieved in some of the more industrialized or more advanced nations, is having good systems in place. Once you can ensure that your population has access to a minimum standard of clean, good quality water, then you can be confident that cholera will be at bay. But the reality is that these things are very expensive to implement, and there's only so many resources available. But the idea is to do it piecemeal. Identify where the hotspots are, because it doesn't attack the entire country at a time. There are specific areas that tend to be prone. If you look at previous outbreaks, you'll see more or less a pattern that is the same areas that become affected.
Yeah.
If you can target the interventions in that way, in a structured and gradual manner, I think it can be achieved. And of course, it calls for not just the government to step in. There are partners, there are developmental partners, humanitarian actors who can also contribute to the conversation and see how this can be achieved. Good, access to clean water and appropriate latrine coverage for the whole population. I think the government has done well. We have a Public Health Emergency Operations Center that is in place and that is coordinating the response between the Ministry of Health and all the other actors, all the partners that are participating in the response. And just bringing people together to share information, share ideas, to pool resources towards some of these interventions that may be a bit heavy, especially in the context of an outbreak which may not have been anticipated or planned for. The government has a really important role, and I think it's taking that up pretty well. We have coordination meetings every week. We inform each other on what is happening and what we are doing in the various spaces so that we are not duplicating our interventions.
Right.
Yeah. And
so just before, there's a caller on the line. I don't want them to drop, but we'll pick up that thought there. Stephen from Nairobi, I think, has a question. Good morning, Stephen.
Morning, Sue.
What's your question for Dr. Barbara?
Okay, I'm from Luxembourg, and there is a mostly in Kawawes, there is no drainage. So for the past two weeks, I've been having a problem with my stomach. And in my family, we are 3 members, but 2 of us, me and my son, we have been trying to treat the diarrhea, but I think it hasn't stopped.
Right.
Can it be the cholera we are supposed to treat, or is just another kind of diarrhea? Because we have been trying to treat it with Amonde medication, but it hasn't ceased.
Thank you.
Yeah, so everything we eat,
all right,
you find you are heading direct to with a diarrhea.
Okay. Just stay on the line.
We have tried to keep the hygiene with the water, the cleaning of services. So I can need a clarification and where I can get the dosage within the sample to the cholera one.
Okay.
Thank you, Stephen. Just stay on the line while Dr. Barbara answers.
Okay, so if I heard him correctly, he's been sick with the diarrheal illness for a period of 2 weeks, did he say?
And his son as well.
And his son as well. Okay, what I would say is for 2 weeks, it's unlikely to be cholera because we haven't touched on what the symptoms are, what a cholera patient will present with, but generally cholera causes a very severe form of diarrhea that can lead to severe dehydration within a matter of hours and even death. Yes, there are mild infections. There are even asymptomatic infections, so somebody has the bacterium, but the immune system has been able to deal with it in one way or another, and they're not exhibiting the classical signs and symptoms of cholera. So I don't think that may be the case for him. However, 2 weeks is a long time. I know all of us have suffered an upset tummy once in a while. If it's just food poisoning, something that you ate that didn't go well with you, it will take a few hours, couple of days, and it goes away. But 2 weeks of continuous diarrhea, especially in a child, because he mentioned that his son is sick, can lead to loss of fluids, electrolytes, and it needs to be investigated. So my call to Steve, that was his name?
Yes.
Just go to the nearest health facility. I'm sure there's a health center near you, and see whoever is there, the clinician or the nurse, the doctor. They can do a stool test. Even for cholera, the ideal is to confirm the cases. We mentioned that there are 239. Some of them were detected based on the symptoms the patient came with, but there are others that were confirmed by the lab. So there are rapid diagnostic tests available, right, especially now that there's an outbreak, that can detect whether it is cholera or not. And if not, then they can do other tests, microscopy, other rapid tests to see what exactly is the bug that is causing him to be sick and get the treatment that they need.
Dr. Ari, what is severe diarrhea?
Severe diarrhea is, in the context of cholera, severe diarrhea is multiple episodes, very frequent, very bulky stool, large volumes. Okay, so this is not your normal stomach upset where you go pass a little poop and come out. Yeah, it'll be disproportionate to what you're taking in, because what cholera does is once it's in the intestinal tract, it secretes a toxin. It produces a toxin that causes fluid to be secreted into the intestinal tract. So you have lots of water, you lose essential minerals like sodium and potassium that are necessary for so many biological processes. And another cardinal sign is that the diarrhea of cholera is effortless. You can't hold it in. It'll just flow out because of just how bulky it is. And so because of that, it will cause a very rapid state of dehydration that will require either oral rehydration salts, if you know the ORS, or IV fluids in order to resuscitate the patient. Fortunately, cholera is so treatable. It's very easy to treat. It's literally just provide fluids and the patient will pick up. And if the quality of care is good, if the access to care is good, then we expect 99% of patients will pull through.
I know we'll come back after the break to talk about things like treatment, even an update on the vaccines, because that's something that was touched on. But you'd already talked about, from the macro level policy, how it can be prevented. I think the follow-up question was on an individual level, what can be done to address cholera? I think that was your follow-up question after the macro. How does it come back to on an individual level?
At an individual level, we've talked of the 5 Fs. That's a good place to start. But also just be cautious. Try and avoid eating out, because you don't know how well, how safely, how hygienically the vendor has prepared the food. I would say street vendors, especially because they're exposed. In our walks in the community, you find a mamamboga whose stall is right on top of a sewer.
Dr. Barbara, you're breaking my heart.
Street food lover.
Those are the realities of people living in some parts of
Nairobi. I'm saying this like street food is, you know. You sometimes you just want the smoky pasua.
Like if you look worried.
Right. I feel you.
What do you want to say? You're with him.
No, I can see it.
Yeah.
I'm just on the definition of what is street food and what's not. You know? Kibanda is street food.
That's a great question.
Because kuna msoa smoky hapa, na ule msoa miwa, na msoa mayai, na the guy who walks around with a flask with tea and mandazis or ngumus, there are those, and then they go into a kibanda. So is that also categorized as street food?
Okay. I think, I don't know. I'm not a connoisseur on the naming of that, but basically eating out. Okay? Food that you haven't made for yourself.
In restaurants. Right. Some restaurants. Whatever it is.
Any restaurant. Because anyone is at risk. It's an equal opportunity.
You're not in control of the preparation.
Exactly. Okay. So unless you really, really trust, I know there are some people who sell these things on the street and they're really cautious. They wear gloves. They have water and soap available to clean the equipment and the food that they're preparing, but there are others who don't. So you need to use your discernment and your judgment. Try and avoid it as much as possible, but if you can't, then be careful what you're eating and where you're eating. Seek treatment early. We said that cholera kills within hours if it's not treated. So if you have, if you are worried, because I think we all know what normal diarrhea is. We've all experienced it, but it gets to a point where you're losing exactly what you're taking in. In fact, the characteristic stool is called rice water stool. So it looks like water that you've used to wash rice, or when you're cooking rice, the water that's boiling
like
on the top.
White.
Yes, a kind of opaque, whitish diarrhea. When you see that, you'll know this is not business as usual. Please just rush to the nearest health facility. It doesn't have to be a big hospital, because we said cholera is easy to treat. Go wherever is closest to you so that you can get the emergency care needed.
Let's take a break, Doc, and then come back and look at, again, the structural and institutional framework that is in place to help us prevent cholera. Coming all the way from, community health promoters, to proper working sewers, to water provision and where we're getting water, and so on and so forth. Food and how food is handled from farm to market to plate,
Yeah.
and all that. And we see structurally how, whether you feel that we are okay or what do we need to look out for. Dr. Barabara Amonde is a daktari who is very big on matters of public health and responding to public health emergencies. She's our guest today. We are talking about a cholera outbreak that's currently in Migori, Kisumu, Nairobi, Kwale counties. So far, 239 cases reported. 11 people have died as a result of cholera. It's a big thing, and that's why we're dedicating time for it. We'll be back in a moment.
400.
Right, and before we continue our conversation in studio with Dr. Barabara Amonde, we have a caller on the line, Patrick. Patrick is calling in from, where is he calling in from, Jackson? There we go, Patrick from Kitale. Patrick, good morning. Do you have a question?
Good morning, guys.
Good morning. You have a question for Dr.
My name is Patrick Kadere from Kitale.
Mm-hmm.
Before I continue, let me say this.
Mm-hmm.
Go ahead, Patrick.
Oh, did we lose him?
Please allow me.
Okay, go ahead.
Zima TV tafadhali,
Mimi
Patrick.
nasema hivi, kwanza nashukuru sana NTV, mnafanya kazi nzuri. Alafu niko na swali kwa mgeni wetu Daktari Barabara.
Okay.
Ni ukweli nikisema ugonjwa ya cholera ni ugonjwa ya maskini. Am I saying the truth or am I lying? I want you to clarify to me, because ugonjwa ya cholera unasikia inayakula watu kama Mkuru Panjenga, Mkuru Parupe, Madare, Uruma, huko hizo ile za watu wachache. Mbona sijasikia yako ugonjwa wa cholera imeenda Kilimani, Doresho, Kitusuru, hata ukiona kama Kitale hapo utasikia ugonjwa imeenda Matisi, imeenda Kipsongo, ile ya watu wa duni. Mimi nataka nijue hii ugonjwa ina ya maskini, na maskini wale wako chini sana, wa mama wamejazana. So ni rahisi prevent ugonjwa, watu wakae mbalimbali ama aje. Because ugonjwa haikuli matajiri. So tuseme ugonjwa ni ya watu. So mtatusaidiaje sisi watu duni? Maana matajiri ugonjwa haikuli, mtusaidie. Tutakula lishe bora ama aje?
Asante,
kama hata pengine ni lishe bora, tunakula vichafu, vitu ile mboga ya haraka. Mbona sijawahi kusikia matajiri wanagonjeka cholera? That's my question, madam.
Asante sana, Patrick.
Thank you, Patrick.
It's a common myth. I mean, it's not the first time you're hearing this. I'm sure that.
That really makes me sad. And Patrick is not wrong. Cholera is a disease that generally affects the poorest communities because. Should I answer in Kiswahili for the benefit? Yeah. Patrick, asante kwa swali lako. Cholera inaweza shika mtu yeyote. Lakini unasema ukweli, kwa mara nyingi ni watu maskini, watu wanaishi katika hali duni, vile kule kwa vitongoji, ambao wanaathirika zaidi kwa sababu ya mazingira wanaoishi ndani. Uko kwa sehemu ya in the informal settlements, hapo ndo utapata sana kuna maji chafu, watu hawana maji nyumbani, utapata maji ya kanjo inakuja mara moja kwa wiki. Kwa hivyo hizo siku zingine inabidi uende ununue maji kwa watu wanauza kwa mitungi, na hujui ametoa wapi hayo maji kwa mitungi. So it is true that it affects people who are in more impoverished situations, because generally in those areas where they live, you'll find that the water is less accessible, the quality is poorer, the latrines are fewer, so they're not, it's not guaranteed that I live in a one-bedroom house with my own toilet. There's probably going to be a latrine ambayo inatumika na kila mtu kwa hiyo kijiji. And also it has to do with awareness. Watu hawajui kuwa kuna outbreaks, ndio? You mentioned that. And it applies to wale wanaishi Kitusuru na Kileleshwa, the places that Patrick has mentioned, but also applies to the people who are at even more risk in the informal settlements. I haven't mentioned yet that I work for MSF, Médecins Sans Frontières, which is a medical humanitarian organization.
Doctors Without Borders.
Doctors Without Borders.
That's the one people know, yeah.
Exactly.
When you say MSF, we're like, oh, what was that? Doctors Without Borders, okay.
Yes, Doctors Without Borders. We are present in 70 countries, and our Our mission is to provide emergency aid, emergency health assistance, medical assistance to populations in need. So we have been involved in the current response to the cholera outbreak. Here in Nairobi, we are supporting Mama Lucy Hospital and Mbagathi Hospital to provide care to patients who've been diagnosed with cholera. We're also supporting Kisumu, Ahero Hospital, now that they have, I think they have the bulk of the cases of the 239 right now. And we have other emergency response activities. We're supporting Marsabit for Kalaza and Wajir County. We also have running projects in Mombasa, in Kisumu, and here in Nairobi, and Garissa in the Dagahali refugee camp. So we have been part of the response, and part of what we're doing is engaging the community to spread awareness. Wale watu ambao kuko wapate ujuzi kuwa kuna cholera inakaa hivi, ukipata ugonjwa unafanya nini, do you need to go to the hospital early. Even sensitizing some of the facilities, including the chemists, because you and I often, unfortunately, even if you have the privilege of having a medical insurance card, if I feel off, my first point of contact will be a pharmacy. Yeah, I don't want to take the time to sit and wait for a doctor in a hospital. Yeah, and of course a pharmacy is very quick to prescribe you something because they want to make the money. But the ideal is to go to a health facility. So we've sensitized these smaller community pharmacies to alert them that there is an outbreak. If they see a case or a potential case, then they can call either the emergency operating center number or the MSF call center in Mathare, and they can dispatch an ambulance to the patient's location so that we reduce the time taken for a person to access care, especially for those very vulnerable people who are living in the informal settlements, whose access to care could possibly be limited. In addition to that, we are working with the existing structures in the community health strategy focal person, the CHPs, community health promoters and assistants. They're the ones who are guiding us in our interactions in the community to understand what is happening and what targeted interventions may be necessary. Yeah.
It comes back into those structural issues that we're talking about. Because just like there's a comment here of somebody who's talking about Ongatarongai and other places where you do not have a proper sewer system. So you have a large urban population. Each of them has sunk their own form of sewer.
Septic tank.
Yeah. And then you also, each one of them there are some who have boreholes, you have no centralized water supply system, and so on and so forth, and how these exposes, right? Do you know of the impact of such informalities, informal areas on our health systems?
Right. Sorry, Eric, just to add on, you hear in places like that where you make your own sewage system, then you hear stories of water bowsers that were exhausters, things like that.
Unfortunately, these things do happen. To create a water system that is safe takes a lot of investment in terms of the material resources, technical expertise, and it's quite expensive. I think it's important for within the public health response, and it's already in place, there are what we call WASH coordinators, water, sanitation and hygiene coordinators within the county departments of health, who are tasked with ensuring that people everywhere have access to clean water and have appropriate sanitation facilities. And they are also very active in the response. They're part of the coordination meetings, and they go on the ground to see where the problems are and take the necessary steps. For cholera outbreaks, we implement something that's called CATI, a case area targeted intervention. So if somebody comes into the treatment you did today and presents with cholera-like symptoms, we confirm it is cholera, we go to their household, okay, and look at what are the risk factors within that home.
Right.
And then provide whatever necessary interventions necessary so that we prevent the other members of the family from getting sick. We go beyond that again to look at the surroundings. So we identify a radius around that case or that patient's home. and look at what other environmental factors are present. And that way, we don't have to expend resources, reacting and intervening everywhere. Rather, we go to the source. And if we can limit the transition within this small locality, then we can prevent further onward spread of infections. So yes, there needs to be some improvement. I must say, though, that during a cholera outbreak may not be the time to implement those interventions. One, because it takes time. Two, because of the cost. You have to mobilize resources. And of course, resources are limited everywhere. And it may not have much impact on the current outbreak. But once the outbreak is controlled, then that is the time to look at what was done, where were the problem areas, and what can be done in this quiet, calm moment to ensure that we don't have another outbreak in the future.
We've got a caller on the line. Robert from Migori has a question for Doc as well. Good morning, Robert. Morning, Robert. What's your question for Daktari?
Actually, I first have a comment regarding on the past phone calls. The guy who was saying that does it mean that cholera belongs to the poor? I don't support that. It is the way the doctors describe. It is a bacteria that it's everywhere, including inside where you people are. It's a very clean place, but how do you handle yourself even after you have visited the toilet? That one can happen even to the rich people. The same it can happen to the people who are living in the slums. So this is a precaution that should be taken carefully, just as the corona, the pandemic 2019. If you go to the record, in 2019 we didn't have any outbreak of cholera. The reason people were taking care of themselves, fearing the COVID. And we expect the same thing to happen day in, day out. My question to Doc is, are the public health officers being underutilized? Are they in the areas where they should be serving? Because I think public health officers should be used as the first primary health cares to help in prevention. Then what she has just mentioned last, that she has talked about under the small, what do I say? She has just said the funds to control the cholera during the outbreak. If we can do it day in, day out, then we will not require more to control the outbreak of cholera. People will be aware, and by the time there is an outbreak, then we will have little to do so that we do away with the cholera. These are diseases that by this time we should be having no more such kind of diseases in this country. Thank you.
Thank you, Robert.
He's absolutely right in so many regards, but I'll just hear Daktari's point. Also, what he has said again, proving that we do have the capacity to quash cholera. And with sustained effort. We've done it before for a year. Why can't we do it consistently? But yes, Doc.
Okay. Thank you, Patrick. I think those reflections were really...
Robert.
Sorry, Robert. Yeah, thank you so much. And he's absolutely right. It's cholera is an equal opportunity bug. It will infect anyone, anywhere. So I want to just get that clear. Nobody is immune, nobody is protected or should fall into a false sense of safety. However, it is more likely that somebody will get infected in those kind of low socioeconomic situations, because we said that cholera is a problem of water and sanitation. So somebody living in poor socioeconomic conditions is more likely to have low access or limited access to quality water, clean water for drinking, for cooking, for taking care of their daily needs. At the same time, this person is also less likely to have access to sanitation facilities. They're more likely to be in an area where the general environmental cleanliness and hygiene is lacking. So that puts people in the lower socioeconomic segment at disproportionately higher risk of infection. It doesn't mean that because somebody lives in Runda or Gigiri, they can't get cholera. They can. And there have been instances in the past where people have gotten cholera from hotels, from eateries.
Big hotels.
Right? So from home, you know, just because you're in a Lexus, you could still be enjoying your smoky pasua, like you said. So everybody's at risk. But because of the exposures of the people who are living in certain conditions, it is more likely that they get infected. Yeah, so I hope that has clarified.
Yes, it's an important clarification. Did I miss out anything? Was there any updates on the vaccines? Sorry, I don't know whether I missed it in part of the conversation we're having. Or can we touch on that now very briefly?
Yes, so the cholera vaccine is useful in managing an outbreak. It's what we call a reactive vaccine. So we provide it when we have an outbreak to try and bring the numbers down. The cholera vaccine usually will confer immunity for a few months to 2 or 3 years. So that's why it's not included in the routine vaccination, because you'd have to keep giving it again and again and again if you want sustained immunity. The best way is just to prevent the cases, prevent the outbreaks from happening. So
it's
the
a
last
stopgap, basically.
It's a stopgap measure, exactly.
Okay.
The last OCV campaign, which MSF was a part of, specifically in Dagahale, was in 2023. If you remember, we had a big outbreak, started in 2022. It was very protracted. It went on for almost a year. And eventually, we had a successful application to WHO for an emergency provision of OCV. And that has protected us, or has provided some protection. You can see 2023 February was the first round. We are about almost exactly 2 years in. And here we are with another outbreak. Yeah, so there is an application in place, and again, it targets the hotspot. It's not something that is provided en masse, like the other.
And it's not lifelong.
No. It's very short-term immunity.
Just within that short time.
Exactly. So it's not something that should take us into a sense of everything security is okay. Even after vaccination happens, all those personal hygiene measures, the provision of water, access to safe to latrines, etc., also need to be in place if we are to prevent an outbreak from occurring once again.
Lenny and Mike are asking, kuna cholera, acute watery diarrhea, and what the British call dysentery and the Americans call dysentery. What's the difference?
How
will one know what's what?
And is it for you to know what's what? I think that would be my addition.
Thank you. Yeah, it may not be for you to make the distinction. It's just about you feel sick, go and seek care at the nearest health facility. But just for the purpose of education, we mentioned cholera. The nature of the diarrhea is very unusual because it's large volume, very watery, and effortless. You cannot control the diarrhea that comes with cholera. Dysentery it's another bacterial infection. It could be bacteria, but there's also one that is caused by amoeba, which is a parasite. And dysentery, literally, the definition is blood in stool. So if you're having diarrhea with blood stains, then that is a form of dysentery, but it needs to be confirmed. So you need to go to the hospital and check, because it might be the stool is actually bloody. It could be a micro injury in the anal area while the stool is passing out. So it's important still to see a doctor. Acute watery diarrhea is any form of diarrhea that has occurred within a short period of time, a few hours, a few days. Yeah, so it could be because of cholera. Cholera is a form of acute watery diarrhea. It could be food poisoning, it could be bacterial, it could be because of antibiotic use, So that distinction is not for the individual to make, it's for a qualified healthcare professional to determine.
Sometimes we question these qualified healthcare professionals because you go to one and they tell you something, you go to another, they tell you something different. For a long time you're being treated for amoeba. And then someone tells you, no, it wasn't amoeba, it was H. pylori. Or it wasn't H. pylori, it was supposed to be something else. How do we distinguish between all these things that are happening in the stomach and they're causing you much discomfort? How do you treat them?
You go to hospital.
And
he's given the reservations, though.
Yeah, I understand. I mean, we all have the same training. There are protocols, there are algorithms, guidelines that tell us what to do when, but there's also people's personal experiences and expertise and knowledge, what they've encountered in the line of practice. So yes, you might find different opinions, but I mean, if you go to a public facility, you're assured that you will get a qualified professional. Go to providers that you can trust, because there's a way that you can tell, you know, whether or not this is a good hospital or not, whether they're qualified or not. And
maybe seek a second opinion as well, right?
You could seek as now
I always say it's a privilege thing, but if possible.
When it comes to issues of H. pylori and other things, you know, there's certain bacteria that are actually living in our gut. You know, they are endemic. Like 50% of people have H. pylori, but it may not be causing them any symptoms. Because if you're fine, you don't need to treat it. If you have the symptoms, then the treatment is necessary. So it's a matter of just sound clinical judgment, and you could go to a public facility. You could also check the medical board. They have registration details for all the qualified professionals, whether it is a nurse, a clinical officer, a doctor, and you can verify whether or not they're good. But I want to believe that we can trust the majority of
our health system.
Yes.
That's true.
Yes.
That's true, Doc. And thank you very much for coming in today and for educating us about the cholera outbreak, and just raising that alert. And let's all be alert on what we're doing. Remember the 5 Fs. Right?
Remember the 5 Fs. And in the context of cholera, MSF has been supporting Mama Lucy Kibaki and Bagathi hospitals. We have CTUs, or cholera treatment units, present there in both places, and we're also supporting activities within the community. So anyone who is confirmed to have cholera or is suffering from symptoms can call the Public Health Emergency Operations Center number or the MSF call center to avail an ambulance to pick them up and bring them into the CTU, where we're providing treatment at no cost.
Are you able to share that number?
Not off the top of my head.
Okay.
It's okay. You can give us, and then we'll share after the break.
We will share it.
Yeah.
Sure.
Dr. Barabara Amonde has been our guest on this cholera conversation. Next up, lest we forget, an accident happened in Titwande involving a train in 1993. And one of the people who were on board that train was Wagodi Mahugu, who will be speaking to us as a survivor of that accident. Lest we forget that these accidents have actually taken place. What's happened to the people since then? 9 a.m. Good morning.